Hey everybody, how are you guys? Hey Melissa, there you are.
Hi.
Welcome, welcome everyone, welcome. Thank you guys for joining us. So we are going to go ahead and get started. We had a little bit of technical difficulty, but I'm certainly so glad that it looks like we've gotten that worked out. Welcome you guys. Hopefully you know who I am. I am Dr. Danette Taylor, and I am a family advocate and parent coach for children, parents of children that have autism. And tonight I have a special treat for everyone. I want to welcome you guys to our session with Melissa Mora, and I am going to have her tell you all about herself. Go ahead, Melissa.
Hi, thank you, Danette. So, hi, everybody. I'm Melissa. I am a board certified behavior analyst of 9 years. I have experience working with kids with autism and related disabilities for about 16 to 17 years. And this is in a variety of roles, such as I've been a behavior therapist, supervisor, parent consultant, BCBA. Right now, I am in multiple roles, such as case management. So for all the newly diagnosed kiddos with autism or related disabilities, I help place them with service providers and teams. I also have a caseload of myself, and I parent consult with some parents and families too. So I do have a lot of experience in this field, and my intention today is to give you guys as much information as you need in regards to if ABA is right for your family.
Well, good. So we are going to get started because we are on a limited time and we want to make sure that folks have an opportunity to ask questions um, at the end of the session. So, Melissa, can you share with us what is ABA therapy and how can it make a difference for families?
Perfect question. Yeah. So ABA therapy is a type of behavioral therapy that uses positive support strategies for behaviors. It uses basic behavioral principles, and it uses it in a systematic way. There's a variety during ABA therapy, but it is widely used with children with autism. It has a lot of researched, you could find a lot of research articles on this, and the data supports that it is very effective treating behaviors, excessive behaviors, and for those requiring skill acquisition, such as communication, self-help, and yeah, things of that nature.
Okay, perfect. So let me ask you a question. So when I hear ABA therapy, I always hear about the BCBAs, then I hear about the RBTs. Can you explain the difference between the two and their roles?
Absolutely. So, RBT is registered behavior technician. These are your boots on the ground. They go in there and they do the primarily all the work as far as hands-on. So, for example, if your kiddo has 10 hours a week, they do the 10 hours a week. Versus, say, if I were to supervise, I were to supervise partial of those hours. But the therapists are the ones that you're going to see in your home every single day with your kiddos and your families.
Perfect, perfect. So, can you emphasize like the importance of having a qualified and compassionate RBT working with a child, and maybe some of those look fors for a good RBT?
Yeah, that's actually a really good question. So RBTs, there's a variety. So there's RBTs and there's behavior technicians. So RBTs are registered behavior technicians. Those have had 40 hours of training from the board, right? Behavior analysis board. And they have, usually every company has their sort of training. So you have to kind of look at that because some of them are called behavior technicians, behavior interventions, but the RBTs are the ones that have a little bit more training. So that's always good to look for. One thing I want to note too, I have a lot of parents asking me, I want someone with a lot of experience and a lot of, years and things like that. you know, that's all great, and of course we value experience. However, I have noticed something that really qualifies a good behavior therapist for those out there, you
Oh,
know,
please
20.
do share. Yes.
So one thing I've noticed, a common theme is if you notice the therapist is shy or isn't so much playing with your kiddo, and obviously this depends on the age, right?
Mhm.
Really makes such a big difference when the therapist is able to get down on the floor, play with your child, be silly, have that energy. Because even if they don't have that much experience, I find it that they learn, we learn pretty quickly things, but if they don't have that natural charisma of like playing and getting down and building that rapport with your family, and also making your child feel comfortable, I noticed that there's not a lot of success,
Mhm.
and parents really feel comfortable with someone too shy or just is sitting, still, just talking to your child. So it's good that you get a therapist that's very interactive, right?
Gotcha. Well, somebody in the comments just asked, would ABA be good for a 20-year-old? So now you're talking about getting down on the floor, and obviously we probably wouldn't be getting down on the floor with the 20-year-old, even if they have, more profound disabilities. So can you talk a little bit about that and what that might look like?
So yeah, so typically, there are adults and teenagers with ABA teams. However, the therapy is going to look different, right? It's not going to be like we're playing, because a lot of ABA with the kiddos is through play. Children learn through play and being happy, right? With the adolescents and early adults, you're going to see a different type of relationship. So you want someone that's a little bit more kind of, I don't want to say friend, but kind, because they have to relate to one another, right? And they have to feel comfortable. So this one's a little bit more tricky in my opinion. So you have to ask your child, do you feel comfortable with this therapist? Do you want them to teach you things, right? It's important for us to talk to our kiddos and ask them what they like. And if they're not able to vocally, verbally communicate this, their expressions, right? We have to honor when any child, how they feel with a therapist. So that's a key indicator. Like, how do they feel with this therapist? What are they saying? Are they like, moving away? Because it does take time for them to feel comfortable with therapist. But if your child or adolescent is displaying those faces, if they're nonverbal, we want to respect their rights as well. And ABA, it's going to work if the child and the family feel comfortable.
Okay. Being comfortable is a huge deal. I have several clients that have RBTs that work closely with their kiddos, and the RBTs actually go to school with them. And so when you're talking about level of comfortability, I also think it's important not just for the kid to have that good working relationship with that RBT, but also for the family, the parents to also be just as comfortable as well. Because sometimes kids have, 40 hours a week, and this person is spending quite a bit of time in your home. So that's also important as well. Someone put in the comments, they have a child with autism, and do you think that ABA is only for behaviors? So if they don't have behaviors necessarily, is ABA appropriate?
Yes, we actually do have a lot of kiddos that are receiving ABA services that don't have a behavior intervention plan, that don't have excessive behaviors, right? This looks like a reduction in hours. So instead of getting so many hours, they have less hours, but also if they have a lot of skills that they need to work on, they could have a lot of hours because of that. So it doesn't have to be behavioral. ABA, what I love about ABA is that there's so much to work on, and there's so much to implement. Because again, we're talking about communication, right? We're talking about self-help. We're talking about, yeah, even social skills,
Yeah,
right?
yeah.
We want to teach our our children to express their needs and wants, and ABA does a lot of that, right? So it doesn't have to be just excessive behaviors, as you mentioned.
Gotcha. Okay. Can you talk a little bit about the pros and cons of ABA and what every parent should really know about it?
This is perfect. I've been waiting for this question. So there's a lot of, should I not? And there are, there's the pros are that it's effective, right? It's effective, it's individualistic. So depending on what your child needs, the clinical team should be geared towards the functionality of ABA in your home with your family. It should feel right. It should fit. They're effective strategies. And a lot of this is through positive behavior supports, right? If the ABA team, and this is a red flag, you guys, if the ABA team is not using positive behavior supports or trying to motivate your child and have your child happy, that is something you need to look at, right? We want our kids to be happy, to feel safe, and to really, learn through play. So those are the pros. It's effective, it's individualistic, it should incorporate parent consultation, right?
Okay.
So there's just so much, and it could be in the community, it could be in different settings. So I mean, it's just wonderful. I do have to mention the cons because ABA is not for everyone. Okay, so that's really important to note. The cons will be it could be intrusive, right? You mentioned, what if they have 40 hours, right?
Yeah.
So that gets uncomfortable. Let's all be real. It could be uncomfortable having a stranger. Yes, they become familiar, but it could be a little bit uncomfortable. Also, it has to be consistent. So let's just say that you have a lot of doctor's appointments or, you want to go on vacation, or that might be a problem for some ABA companies, and they might even talk to you about, hey, you're missing a lot of sessions, so it's a little bit intrusive. It might be uncomfortable. You might not have time. So, that's another thing, right? So let's see, we talked about time management. I feel like I'm forgetting something. Being intrusive. You might not agree with the clinical team. So this happens a little. There's inconsistencies in what the clinical team is recommending, and the parents like, I don't know if I feel comfortable with that, right? So that could start as a con, but then as long as you guys talk about things together and address what's the most important thing that you guys want to address, then it could be actually a pro. So, depending on, your insurance, the co-pays, the payments, right? So the availability, things like that. Some parents don't feel comfortable with so many demands being placed.
Okay.
Child. And that's all, also based on how you feel comfortable, right? You could just tell your team, hey, instead of placing all these demands, can we work on this? It should be a group effort, right? So I think that's, I feel like I'm forgetting something.
So we have another question. It says, can ABA be geared towards transitioning out of the home?
Oh, for
Yeah, she says, I don't think my daughter is ready, but she's 20 and is seeking independence, and she just doesn't want her to leave home without a plan. So is transitioning something that they can work on?
they do work on transitions,
Okay.
but that would be more, it would be, I want to say more parent console and transitions. Like, for example, your services would be more geared towards that. So, for example, we could work on transitions, but for example, having a life plan, like what you teach, I think that's super important, because so you could work hand in hand with the parent consultant using strategies, and like something like yourself, Danette, where you have that plan of like, how are we going to do this? So you guys could work together in that sense. Yes.
So can the parent request what they would like the ABA, the RBT to work on?
Parents can tell the clinical, the supervisor and the BCBA,
Okay.
not the therapist. The therapist is taking instructions from the BCBA and supervisor.
Gotcha.
But
Gotcha.
parents, they tell the clinical team, I'm interested in doing X, Y, and Z,
Mhm.
or not interested in direct therapy. Would I qualify for a parent consultation model? Right. So
Okay.
there's just honestly, there's so much.
Right.
There's so much to learn and there's so much to know. So yeah, I'm sorry if I'm leaving certain things out. There's just a lot of information about this.
No, you're good. Thank you. Someone asked, how do you find an ABA therapist?
Um, so what you want to look for is an ABA company, right? So usually your insurance provider, your primary care physician will refer you to available ABA companies. And basically ABA companies take kiddos based on availability. So that's why you want a variety of options. A lot of parents ask me, should I look at the reviews or what if they have bad reviews? To be honest, most people that leave reviews are unhappy customers. That and in my experience, because I've worked for a variety of companies and I've seen it really boils down to the therapist and the clinical team. And if you have a good team,
Okay.
right? Because some great companies, man, they have a therapist and it's just not working out. And it makes a big. So you really want to make sure that you ask your insurance and who they cover, or if you want to do private pay, I mean, just look around in your area and see who's available to take on a case and see what their overall intention is, right? What their culture is in that company to see where you feel the most comfortable.
And I know you already touched on the pros and cons, but if we can go back to that for a second, because I've had some clients say to me, well, I don't really think that ABA is good for me because it's too rigid.
Oh,
And in my mind, I don't care what methodology it is, you can always make it less rigid if you want to. So can you share a little bit about people that have that mindset, like, okay, ABA is too rigid, so I'm not going to use that, and essentially I'm not going to do anything.
thank you. Oh my God, that's what I forgot. Thank you, Danette, for telling me that. Yes, so I do have a lot of parents that have that concern where it's too rigid. They kind of feels a little robotic to some parents, and that's absolutely, you're right. It depends on the clinical team and it depends on the structure. Some of them use methods where they're just on the table and they're just doing cards and they sound kind of, stiff a little bit. You want to make sure it's natural. I'm a big advocate for natural, functional to your family. If that's how the clinical team is addressing, perhaps you might want to ask for a new one or just tell them, like, hey, can I have more naturalistic strategies? Because there are. ABA has a lot of tools in the toolkit. If it seems too rigid, it's because we just need to have a conversation with the clinical team and tell them, hey, it's feeling too stiff. It's too, I don't want my child sounding like a robot. Can we please be more natural? Can we please do more play? Can we please use more, natural opportunities to teach communication? There's just so much. And thank you for bringing that up because they could potentially lose on something so wonderful, for thinking that all ABA is that, and it isn't. And it does have some people do feel that way. And that's kind of the cons that have been, set out there, but it could be very beautiful. It's just about that communication that you have with your team.
And I know I jumped the gun a little bit earlier, but I wanted to answer one of our viewers' questions. So can you share a little bit about how ABA therapy evolves as the child grows and as they enter adolescence? So they're starting out probably very young. A lot of parents, they're 3, 4, 5 years old. If you can just share what that looks like, how that therapy evolves as they get a little bit older.
Sure. So when they're about 2 or 3, the therapy could be a little bit more intensive, right? It could be 4 hours. It could be through a lot of play, right? It could be mainly communication. As they get older, obviously the needs are changing. It could be you know, maybe more social skills, right? As the kiddos get older, they're entering school too. So we have to, you know, what's going on in the schools as well. And I know you talk a lot about IEPs and things like that. This is so important because ABA is not just in the home, it has to be in all settings. So in the school environment is super important to coordinate care with the teachers, right? With everybody in the school, because we all have to be supportive to this, right? So that it could be functional. I'm not sure if I'm answering your question, but it's so individualistic, to be honest. I can't say like this is the way it goes. Every child, depending if they have, you know, a mild, you know, need, or if they're more severely impacted, then they're going to require different supports. But what I always recommend is having a comprehensive, right? So making sure we talk to their, you know, their doctors, their school staff, right? Making sure that their teachers and their other service providers are being very helpful. So it's kind of hard to answer that question because it's just so big.
But you make a valid point about school. And as an advocate, I see so many times where there's a huge disconnect between the services that are happening in the school setting versus the services that parents are providing or allowing their child to have in the community.
Mhm.
So those private services and the schools services, they rarely talk. The only time that they really even talk to each other is when it's time for an evaluation, or if a parent has asked for an updated evaluation, and they'll say, okay, well, can you sign a release so we can communicate with, you know, your ABA or your BCBA? But essentially, a lot of times they're really not communicating. All they want to do is see on paper what data they have. You know, most of the time, some sort of test scores or something like that. But if private providers and schools were really working hand in hand, I can't imagine what progress would look like. And I don't want to touch too much on school because I know we're going to talk about IEPs and ABA at our next session. But it's a huge concern because there are some states, some school districts, I should say, that allows the RBTs to come into the school. Um, Florida is one of those states where there are certain school districts you can bring your RBT to school with you, and I think that that is absolutely amazing. And then there's some states and some school districts that they will not let anyone in their school. Always concerning to me because, like, what do you have to hide? They're here to support the child. What's the big deal? But how do you think that parents should approach the school when they want them to work with that ABA therapist? Do you think that the ABA therapist should come to the IEP meeting? Should they be invited to those IEP meetings? How do we get parents to help forge that relationship between the school and private provider?
Really advocate for their child in the telling the clinical team, hey, I want the coordination with the school, and telling the school, hey, I want to bring in my BCBA or supervisor to the IEP, and I want to exchange numbers right from the start. It should be right away, like you said, so that could be that continuous communication. And, you know, I want to say that all the BCBAs are going to approach families and ask for this information. But to be honest, the parents have to upfront and tell both parties that they need to communicate to promote this, you know, collaboration. So important. And like you said, it makes such a big difference for us to communicate, right? So, yes, they could. A lot of BCBAs, including myself, have gone to many IEPs, and preparing parents beforehand to ask certain questions, it's super helpful. If they can attend with you guys, you guys can make a meeting prior to the IEP and discuss concerns, and they could kind of guide you and give you kind of like a, you know, a pep talk too.
Right.
Yeah.
Okay. Someone asked about specific questions to ask a BCBA company or ABA company, I'm sorry. Do you have any specific questions that a parent should ask, or some tips on that when they're looking for an ABA company, what questions they should ask them?
Honestly, it's whatever providers available, and I hate to say it like that, but there's just so many providers, but it's hard to like I've said, there's great companies that sometimes it depends on the clinical team. You just have to go in there and try a clinical team and then just state to the intake people like, hey, I'm looking for a team that has high energy, or I'm looking for a team that's more, and then they'll hopefully pair you off. So that's what you want to do. It's not so much the company, because there's a lot of great companies out there. What you want to do is you want to look at the teams. And if you have a preference, like, hey, we speak Spanish in my home, can I get a Spanish speaking therapist, right? Or, hey, I don't feel comfortable, with the male. Can I get a female? And sometimes we strive to make sure the parents feel comfortable, right? So basically, like, talking to them about what your preference is about, language, right? Things like that. But as far as an ABA team, I'm direct you to go to your insurance provider and say who is available. You look at all of them and you look at maybe their website and see, okay, what are they geared more towards? Do they focus more on this, or do they focus more on that? So it's based on your preference, but definitely right when you guys get started, please, 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 I want to shout it from the rooftops. Tell your clinical teams what you want. What are your main goals? Do you want to focus more on communication? Are you really concerned about their elopement? Make sure you write. It's like going to the doctor's, right?
Right.
Like, ask your questions right in the start. I have a lot of parents that come to me and go, oh, I have this concern and blah, blah, blah. And I'm like, have you talked to your clinical team? And they're like, no. And I'm like, please tell them.
Right. 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 And that's definitely good advice, because sometimes parents feel like, okay, well, they're the professionals. They know better than I do. No, you know your child. You know what your child needs. So yeah.
Thank you. They are professionals, but parents are, your child the best.
Yes.
You guys are us. So I'm telling you, communication, communication.
Right. Right. Someone asked if BCBAs are allowed to come to school, what role would they play in the classroom?
The therapist, the BCBA and supervisor observe in the classroom, and we set that up. And then if they allow, we'll have a therapist go in there and do the therapy.
Day to day. So it wouldn't be the base BCBA that would be in the school every day with the student. It would be the RBT.
Not every day. The BCBA, if it depends on what supports they're allowing and how much we could get in there. But if it's just talking to the teachers and principal, or other staff, it would be the BCBA.
Okay. But the RBT is the one that could go to school with them if they have like 40 hours a week.
Yes.
Okay. And what role would that RBT play in the classroom?
That's really important, because school ABA and home ABA is completely, it looks different. So I recommend, my favorite is to have both in the home and in the school. You're going to get beautiful progress like that. And in the school, it's more like, it's not so much an aid. We want to be as least intrusive as possible, right? We want to create, we want, sorry, that distracted me. We want to create independence. I'm going to watch my hands. We want to create independence, and we want to make sure that we are being supported and we're not interfering with the academics.
Right.
And there in case they have behaviors, in case they need support, in case, like, for example, if they're having difficulty coping, we're there to support. We're modeling coping strategies, right? If they're getting aggressive, we're providing behavior strategies that are recommended in a safe way, right? So it's super important. It looks different. We're not as hands-on, but if we are needed, if they are eloping, we're right there, right?
So it's that real time in the moment support for when things happen.
Yes.
Okay.
Yes.
I have had experience with a really, really good RBT. She was amazing. And it seems like the ones that are amazing always get promoted. But she was working with one of my clients, and teacher wanted to make her like a teacher's assistant. So she was giving her like the work to teach the student. And so what do you say like to families? Do you tell them, okay, the RBT is not there to be another school employee. They are there to support my child. Or if the RBT feels like, well, it's okay, I can do it. Do you think that they should do that? Do you think that that's their role to support in that capacity? Or is it strictly like, no, that's not what I'm here for. I'm only here to support the child. But essentially, you know, if the child is in a dysregulated state and they're trying to get them to regulate it, and they get them to that point and they can give them, I don't know, that worksheet or whatever that is for them to do, would that be appropriate? Or do you think like, no, there's a fine line between the role of the RBT in that classroom and what they should and shouldn't be doing?
Yeah, that's always tricky, but the way I tell like my staff that's in the schools, I tell them to be the least intrusive because we do not be restricted. We don't want to be restricted. We don't want them to depend on us. We want them to be inclusive in the classroom, right? So we want to make sure that we teach them and we de-escalate any behavior, but then prompt them to pay attention to the teacher, or the teacher, and the teachers will kind of sometimes be like, oh, well, they're going to handle it.
Right.
We want to make sure that this one's very fluid, you know, because it depends on the child. But the way that I like to do it personally is, you know, give them a lot of support and let them know that we're going to start backing away. We're going to start fading away to promote that independence, right?
Right.
But we don't want to have them teach and be a tutor. Basically, we want the teacher to do that. We're there for the behaviors,
Right.
and to help with communication. We're not there to teach them 1+1, right? So sometimes therapists have to prompt the teacher like, okay, they're ready for you to give them instruction.
Okay.
Right? So we also have to, you know, tell the supervisor, hey, you know, tell the therapist to do X, Y, and Z. So it gets tricky. I'm not gonna lie.
So somebody asked, and what if the school doesn't allow this? I'm assuming their meeting doesn't allow the RBT to come into the school. And I can talk a little bit about that. One, you want to make sure that it's a district policy and not a principal policy. There's some school districts that they allow RBTs to come into the school district in any school, but the principal will say, no, they're not going to come into my school. So you want to find out from the district level, you want to see it in policy. If they say, no, we don't allow that, okay, can you direct me or can you send me a copy of the policy with it highlighted that says that you don't allow support personnel to come into the school, because there are kids that have mental health issues that their therapists come into school all the time. But a lot of times they're doing that one-on-one, like in a private office or something like that. But just make sure that it is the district's policy and not the principal's policy. Like I said before, you may not have been on, but there are school districts that do not allow it. A school district that I worked in for many years, they don't allow outsiders to come in and observe. They they don't want that. They didn't want anyone to see all of that good stuff in there. But there are districts that don't allow it. So when a district doesn't allow it, what is your recommendation, Melissa, for families if the district says no?
I tell them, okay, well, if you're not allowing me to bring in my behavioral team, how are you going to address these behaviors? What is the intervention plan? Can I get a functional behavior assessment? What does the assessment say? And they have to have answers for that, because your child has the right for that behavior support. So we really want to ask those questions, like who's doing this, right? Who's supporting with the behaviors?
Exactly.
Do all the teachers know the behavior plan? What proactive strategies?
Exactly, exactly. And as a former educator, I'm probably going to get, you know, my hand smacked for saying this, but you know, the therapists are the experts in behaviors, and quite frankly, most educators are not experts in behaviors, right? They're just not. They're just not. And so the district may have, you know, a handful of people that are behavior experts that come in to support the teacher with behaviors, but the reality is a lot of times people think they have it handled. And so that's why that collaboration between the private provider and the teacher and the school staff is so important. Because if you don't go ahead and make that connection between, you know, your entire tribe for your child, you may have someone that says, well, oh, I got it, I'm fine, and they never reach out to the district staff that's the expert to help them, right? I've had a family asking for an FBA. They didn't know what it was called, but for 2 years asking for this. And someone said at the meeting, well, she didn't ask for an FBA. No, she didn't, but she said she wanted an assessment to see what, you know, the antecedents were to his behaviors, like what's causing the behaviors, what was the function of his behaviors. Just because you don't know the acronym or what it means doesn't mean that you shouldn't provide it. So when you have that private provider that can speak some of that lingo, because there's a lot of crossover into that jargon, and in some ways they're not, but someone that can speak that lingo and say, hey, well, you know, Johnny needs an FBA, that's important, because as a parent, you may not know what that is, but I can guarantee your behavior therapist knows exactly what it is.
Yes.
Yeah.
And FBA is functional behavior assessment. I saw some asking.
Yeah.
So absolutely, I agree with you 100% on that.
Yeah.
Thank you.
And I will say, if any child is having any behaviors and your child is school age and in school, you should be asking for that functional behavioral assessment. You should not be waiting too long. There's no reason for them not to do it, other than the fact that it takes time to collect that data. A lot of times school districts don't want to do it, and they're like, oh, let's monitor. Well, no, let's not monitor, because that's your right as a parent to have that assessment done.
Mm-hmm.
Yeah, yeah, yeah. Okay. Can you go ahead and share your personal approach and philosophy when working with families? And then if you can share some details about your practice and your services and how families can reach you for support.
Wonderful. Yes. My personal philosophy with working with parents is natural, functional. So every intervention, every team, every therapy is functional to your family. That's number one, or else it's not going to be sustainable, right? So it's not going to be long term. The parents aren't going to want to do it, you know. It has to work for your family, just like anything, right? So it has to be. So that's me. I like to work like that. I like to make it as natural as possible, as reinforcing, as fun, as positive. And I really do believe that's the most effective for any, you know, ABA agency or clinical team, right? So, sorry, what was the other question you asked about?
Your philosophy, and then I wanted you to share about your practice and your services and how
Oh,
families can reach you for support if needed.
yes, thank you.
Yeah.
So I'm opening BX consultations. It is to help parents educate themselves, because I hear a lot of people waiting for services. They could wait 3 months, they could wait a year. There's no need for that. So I wanted to make sure that you know, in the BX consultations website, all the information that you need to get started is right there. Parents are confused as to where to go, what to do, what's next. Then when they get to me, their case manager, they're exhausted. They know what to do. So I created a nice little roadmap for you guys after diagnosis and into services, what to look for, you know, red flags, green flags, things like that. What is ABA? For everything we talked about, but in more detail. And there's also a free course there on logistical, what is ABA, because I think it's important that if parents are educated, they're going to be able to advocate even more for their child in therapy. We don't want to receive the therapy and clinicians have all these words that parents are like, what is this? So that's why I created BX Consultations, for a self-paced educational program for parents in case they don't want the direct, or they don't want to, you know, be stuck with an agency and they want to kind of take courses on their own, right? So more courses are going to be out by summer, but right now we have pre-course, an intro to ABA, and learner readiness. Learner readiness for those kiddos that are about to go to school and you want to get them
Love it.
prepared.
Love
It's
it.
super amazing. So it's just to educate and parents and empower them to learn that themselves. Because let me tell you, if a behavior therapist that's in college in their 20s could do it,
That's right.
you guys can do
Absolutely.
it.
Absolutely. And I love that your company is empowering parents. You're getting rid of the gatekeeping,
Yes.
right? And so for me, that's huge, because our parents need to be empowered to be able to do some of these things on their own, because they're not held hostage to a provider just because that provider is the one with the license. So thank you so much for sharing that. And if you guys didn't catch it in the comments, it's at www.bxconsultations with an s.com. Again, it's www.bxconsultations.com, and I'll drop it in there again. So right now, if you guys have any questions, can you post them in the comments, and we're going to start answering some questions that you have. I think I saw that I missed one earlier. Let me go back. Okay, here's one. What about school districts saying they are continually collecting data without giving you information? Ooh, do you want to talk about that one, or do you want me to talk about that one?
You could talk about it and I'll chime in if I see fit.
Absolutely. So one, if they're doing an FBA, a functional behavioral assessment, there is no ongoing data forever. You should be signing a consent to evaluate for that, which in most states, that's going to be a 60-day timeline. In some states, it's like a 45-day timeline before they have to come back to discuss it. So a lot of FBAs, they will tell you that, we need 30, 45, 60, 100 days to collect data. No, they don't. Most school systems will do 10 consecutive days of data. Some will do more, but as a rule, like school districts per se, they look at 10 days of data, and it's supposed to be 10 days of data across all environments within the school setting. So that's every academic subject, recess, PE, lunch, transitions, all of that. And then they should be coming back and having that discussion with you about it. But there is no constantly collecting data. If they're doing that and they're coming up with nothing, that's when you have to drop the hammer and say, thank you so much for giving me 600 days of data. But at this point, I'd like to exercise my right to have a consent to evaluate. And I know that an FBA is a part of my rights to have as an evaluation. And so you basically shut it down. And if you can't shut it down on your own, you need to call an advocate. You're welcome to call me if not, but you need to call somebody to help you if they're not listening to you. And you can go ahead and chime in too.
Of course. Yeah. And so in regards to the functional behavior assessment, the FBA, with any behavior specifically, it's fluid. So if they're taking months and months and months, the kiddo was here and this month and they might be somewhere else.
Right.
So we're losing intervention and we're losing time. And in regards to behaviors, we just need a solid three, like let's just say they elope. We need a solid three to five occurrences to have a hypothesized, intervention. Like, this is what's going on. We're going to try this, right? So we don't really need 20 occurrences of them eloping or hitting themselves. We just need 3 good detailed instances, and we can make a plan. And if that's effective, then we move on. So really, the data taking, it shouldn't take a long time. I could finish an observation 1 week and do the second observation, and then within 3 weeks I could write a report. It shouldn't take very long, to be honest.
Absolutely. Do you guys have any more questions? Can you go ahead and post it in the comments before we wrap up? We would love to answer any questions that you may have before we go. All right. You are your own advocate for your kid, I guess, right? Me, I was. My kid is now an adult. Hopefully you've seen my son Quincy Q on my channel. He's 24 now, but yes, I was my son's advocate. But when my son was in school, I was actually an educator when he was in school. I have only become an advocate since he's been out of school. So, yeah. All right. Is there any accommodations I should be asking colleges about for my daughter? Well, if you have a child that has a disability, you should be asking colleges for accommodations. What those accommodations would be would definitely be specific to your, your student. You may want to look at the last IEP and to see if it was a good IEP, I would say, and see what type of accommodations your child was getting before. And you can ask the colleges for those same accommodations. Believe it or not, people think that, oh, you don't have an IEP in college. Well, you don't have an IEP in college, but you do have ADA rights. So you have rights under the Americans with Disabilities Act, where your child can receive accommodations because they have a documented disability. And with that being said, they're entitled to accommodations. So yes, yes, yes. Again, guys, Melissa has an amazing course and she has put $0 on it. So to me, that's priceless because the information that she is sharing with you guys is very much so in depth and it is priceless information. So please go to www.bxconsultations.com. And hold on, this should be, I should link with everyone. Oh, absolutely. Thank you for sharing. Yes. Oh, yes, you are your own advocates. You are your biggest advocate for your child. Absolutely. Absolutely. You're the biggest voice for your child as well. Yeah. The only challenge sometimes is that parents don't often know how to or what to advocate for. So that's why it's important for them to know what their parental rights are. Yes. Thank you for sharing that. And thank you for clarifying that. Thank you guys. Thank you so much, everyone. You have a good night.
Bye. Thank you.